I would now like to demonstrate for you a generalized examination sequence at the wrist hand. Prior to entering our examination sequence, what we want to do is we want to assess for the big photo or the observational component. So we're looking for any atrophy as well as swelling that may or not be present. We're looking for asymmetries between sides. We're looking for any cyanotic changes that may be occurring with respect to the color of the skin or the temperature of the skin. And after that, what we'll want to do is then enter into our active range of motion examination sequence. I will be integrating both active range of motion along with passive range of motion as well as the manual muscle testing. So let's perform wrist extension, please. Very good. And here we go. I'll provide an overpressure here. All right, excellent. Maintain that position then and resist me, please. Thank you very much. Go ahead and turn your hand palm up for me now. Thank you, and we'll perform wrist flexion. So go ahead, bring your hand up. Thank you. I'll be stabilizing here and I'll be taking them to end range, providing an overpressure. Very good. Assessing for pain with each of these maneuvers I'm asking my patient to perform. So next, resisted wrist flexion. Very good. And go ahead and relax. Now let's have you bring your hand over like that and hold that position. That will be ulnar deviation. Take them into end range and overpressure. All right, very good. Now hold that position. Don't let me push you out. All right, very good. Now let's do radial deviation to the other side. Thank you. Here we go with an overpressure. Excellent. And now hold that position right there. Don't let me bring you back to midline. Very good. Very strong patient. All right, now go ahead and put your forearm and wrist here in a neutral position. What we want to do now is assess for supination and pronation. So put your palm flat on the table for me, please. Thank you. And now here we go with some overpressure. Very good. And what I'll now ask him to do is to try and bring his palm back up, facing up. So this will be manual muscle testing for supination while I provide a resistance. Very good. All right, now go ahead and put your palm up for me, please. Excellent. Now I'll provide an overpressure here. All right, very good. And then I'll just ask him to try and push his palm back down while I provide a resistance, now testing for pronation. All right, very good. Now what we want to do is we want to assess all the movements at the thumb joint. So I'm going to first start off with abduction. So bring your thumb over. Perfect, thank you. And now I'll provide an overpressure here. All right, excellent. Now hold that position and come back to midline. Very good, while I provide a resistance. All right, excellent. Now make a thumbs up for me, please. We'll test thumb extension. Thank you. And provide an overpressure. And now hold that position right there and don't let me resist you. Go out to the distal phalanx here and test that. We can also test here at the proximal phalanx to try and differentiate between muscles. Very good, thank you. All right, now here he is in an adducted position, so I can just go ahead and take him. Relax your finger for me, please. I'm going to take him into passive adduction with an overpressure. Very good. All right, great. And go ahead and push out against me. That is resisted abduction. Previously I had shown resisted adduction, pardon me. So again, just to differentiate, if I resist here, this is resisted adduction, and if I resist out here, that's resisted abduction. All right, so we need to go ahead and assess for flexion at the thumb. So go ahead and flex your thumb for me, please. Very good. A little bit of opposition there. So we'll position him here with an overpressure. Good. Ask him to hold that position and don't let me pull your thumb out. Again, the distal phalanx, we're providing pressure. All right. Now go ahead and bring your thumb and your pinky together, testing opposition. All right. Very good. Now you can hold that position and I'll manual muscle test. Very good. And relax. And I can come over here now and provide an overpressure. All right. Excellent. So the thumb and the wrist have been assessed. Now let's go ahead and move on to the metacarpal phalangeal joint. What I want to ask my patient to do is to flex at his metacarpal phalangeal joint while keeping his digits extended. This is assessing the lumbricals in a general way. All right, very good. We can provide an overpressure here. All right, great. We can ask him to hold that position and we can test all the lumbricals grossly. Very good, very strong lumbricals. I can now assess for passive range of motion extension here at the PIP and the DIP for each digit. very good. A quick general screening technique that we can utilize is just to ask our patient to make a fist as well. So you can go ahead and do that right now for me, please. Great. And now we've covered all the bases as far as range of motion is concerned at the wrist hand. Next, what I'd like to do is I'd like to perform our motions. So I'll ask my patient to go ahead and position his forearm here in neutral once again. And I'm going to go ahead and perform radial and ulnar deviation glides. So in this position, I'm going to stabilize it as distal forearm. And I'm going to grab here at the proximal row of carpals, and I'm going to provide a force ulnarly directed. So this is an ulnar glide. So my force is going down towards the plinth. If I stabilize here at the distal forearm, I can grab again the proximal row of carpals, and I can with my left hand in this direction, and that is a radial deviation. I can go ahead and assess the mid-carpal joint by stabilizing the proximal row and going to the distal row and performing the same passive accessories. Very good. All right. And then I can turn his hand over and I can do the same thing, just looking at the dorsal and palmarly directed or volarly directed forces, otherwise known as APs or PAs, at the same joints. So here I'm stabilizing the distal radius. Now I'm going to be stabilizing at the proximal row of carpals, grabbing the distal row of carpals, and again providing a posterior to anterior and anterior to posterior force, assessing for patient pain. Next, what we can do is we can enter into the palpation component of the examination technique. And so what we'll want to do is we'll want to perform a systematic palpation exam. So we'll have him place his hand up just like that. We'll want to start at the proximal row of carpals and move distally. So I'll start here at the scaphoid. I can go into the anatomical snuff box, which is right here. Go ahead and, yes, extend your thumb. Thank you. Here's the snuff box. So here I'm at the scaphoid bone. I can come over. I can palpate the scaphoid tubercle right here. I can come over and I can palpate the lunate volarly or dorsally. Ask them to go into wrist extension here. Kind of find a divot, place my finger there. I go into wrist flexion, the lunate will pop right out. We can go across now to the triquetrum, as well as come up to the pisiform, go over to the hook of the hamate and into the canal of Guillain, and then just continue on with our systematic palpation examination, trying to identify the presence of our patient's pain. So we've completed active, passive range of motion, as well as passive accessories now, palpation and manual muscle testing. What's left is to perform special tests in order to try and identify or rule in the presence of a pathology. And you can refer to our special test section for the wrist hand to identify those tests that are highly specific.